So during your pregnancy, there's several tests that you'll be required to have at your visits. Typically, testing for blood work is done at 16 weeks. The blood tests that are taken at that time is your prenatal profile, which is your blood type, your Rh factor, a complete blood count, your HIV status, your hepatitis status, your syphilis status. We also do a urinalysis and a urine culture, and that's all your baseline lab work that we do. Also, we do testing at 26 to 28 weeks, and that's when we screen for gestational diabetes and we review your complete blood count to see if anemia has developed at that part of your pregnancy. The last bit of testing that's typically done is between 35 and 37 weeks, and that's when we do a vaginal culture for the group B beta strep. Those are the tests that we typically do. Sometimes there's additional testing required, and that's handled on an individual basis, and I'll address that with you at the appropriate times. As far as scheduling these lab tests, we do it at the visit prior to the appointment that is needed. So let's say you have your first visit with us for your first OB visit. We'll schedule your next visit, which would be for an ultrasound, which we'll talk about further down the road. And after that visit, we would schedule your prenatal blood work. So you don't have to worry about scheduling all your lab work at that first visit. We have labs in all of our offices, so we're accommodating to your needs, and you don't have to run to outside labs.